How's it going, everyone? My name is Joseph Ruggiero with Rugglion Digital Marketing, and I'm here on behalf of Lake Erie College of Osteopathic Medicine, also known as LECOM, with Assistant Professor of Pediatrics, Dr. Coseo. Today we'll be covering various pediatric subjects, catering to students that are seeking further medical education in pediatrics. So, Dr. Coseo, what motivated you to specialize in pediatrics, and what aspects of this field do you find most rewarding?
Well, so I've always loved working with children, and that's initially what drew me to pediatrics. But what I found is that in pediatrics, you get to take care of not just the child, but you're really taking care of their whole family, because the parents play an integral part, obviously, in the health and welfare of their children. So I've really enjoyed that.
So with dealing with an adult patient opposed to a child, how does the care change? I mean, how would you handle how would you handle an adult patient opposed to a child patient as far as emotionally, physically? I mean, it has to be different.
Right. Well, so at every age, children have different abilities to understand themselves, their bodies, what they're feeling, their health. So you have to consider that, because each patient that walks through the door is potentially at a different level or different age. So you have to consider, where is the child at? Can they even tell you their symptoms? And also, who is the caretaker of that child? And you depend on them as well too, versus an adult who can, act as an individual.
Right, of course. So describe a typical day as a pediatrician. What do you see day to day with patients and conditions that you encounter?
So it can be a good variety. We do a lot of well care, which is preventative type medicine, making sure children are healthy and meeting their developmental milestones, because they change so dramatically from the time they're born to the time they're a young adult. So we do a lot of that. We do a lot of preventative medicine with vaccinations and teaching both the child and their parents about how to remain healthy and good, healthy habits. But we also see a variety of illnesses as well too, everything from the minor kind of upper respiratory infections to chronic illnesses as well.
Right. For you as a pediatrician, it must be a little bit gratifying saying that you have seen the trajectory of a patient as a child all the way up to an adult. I mean, for those that stay with you for that long, what is it like for you seeing just the growth in an individual for that period of time?
That's one of my favorite parts about it. I love, when I get to see them as a young child, see how they develop, what kind of young adults they turn into. And I've even had some patients come back and bring their own babies to me, wow, which is a lot of fun and really interesting, because I've seen them grow up to an extent. And that's very gratifying, and that's one of my favorite parts of the job.
Well, it speaks a lot about your care, and I'm sure what you provide for these patients, that they do bring their babies back and come back. But I'm gonna flip it around a little bit. Tell me about the challenges you face as a pediatrician. There's got to be some that you commonly face, and how do you navigate them?
Well, so there's very basic challenges. For example, young patients that can't verbalize what they're feeling, or where their pain is, or what's not feeling well, or if they're not feeling well at all.
Right.
And that's the part that makes pediatrics a little bit tricky and a little bit fun. Of course, you have a parent or caretaker who can give you some information, but sometimes it's a little bit like detective work. So we rely a lot also on physical exam and just observing the child.
Right.
So that can be a challenge on the most basic level. Also, depending on where you live, sometimes you have to act as part general pediatrician, part specialist, or a conduit to a specialist, because especially if you're in a small area, you don't always have a lot of specialists around if you're dealing with something more significant or some type of chronic illness. So I'm on the phone a lot with specialists, at different pediatric centers. We have to refer out a lot to those type of centers as well. And sometimes we don't have all the services we need for our pediatric patients, and that can take a lot of grunt work, not, of course, partially on my part, but also all of our wonderful nurses and social workers and patient care coordinators. We rely on them a lot for these type of things to help connect our children with the services they need.
Right. Yeah, it's got to be difficult for like an ornery baby that, can't really vocalize what they're going through. I mean, I can only imagine what it's like trying to figure out a situation like that.
It definitely can be a challenge. You start to just learn certain clues or look for certain pieces of evidence that can help you figure out what's going on. Sometimes it's very hard and near impossible to figure it out. And that's part of the challenge and also what keeps it interesting.
Right, I'm sure it keeps it interesting day to day. Tell me a little bit, at least in your experiences, for a medical student, what are some qualities and skill sets that make you a successful pediatrician and that could make them a successful pediatrician in the future?
Well, so first of all, I think you have to be a good listener and a good observer. I think that's probably with any physician, but especially with pediatrics, because you're not just listening to the child or the pediatric patient or adolescent, but also their caretakers or parents, and observing, being able to watch what's going on in the room, not just with how the patient behaves, but the interaction between the parent and the child. So I think that's very important. Being a good listener and being patient. Children are a lot of fun. Parents are a lot of fun,
Sure.
but sometimes you need to be patient because sometimes, situations can be intense, and so having patience and being able to deal with different children's behaviors and parents' behaviors is really important too. And being able to have fun, I think that's a huge part of it. You have to find some fun in it. Otherwise, a child having a fit will really wear on you. Yeah. So I think that's important.
I could only imagine. Yeah, you definitely want to have fun day to day, and children come out with some of the most brutally honest things ever. It's
honestly, it's one of the best parts of the job, though. I really enjoy my time with my patients, and sometimes I don't even want to leave the room.
Right.
But I have to get back to work.
Right. So I want to go off script a little bit.
Okay.
With some key qualities and skill sets, in dealing with these patients. Have you seen anything, different with like the rise in technology? Do you find that kids are a little bit apprehensive to be social or socialize?
Absolutely. Kids are in a whole different world when it comes to their social lives than I was or others my age were growing up.
Right.
So it can sometimes be hard to break them out of that shell. But the technology is here and it's not going anywhere.
Right.
So the key is finding ways to reach them somewhere in the middle or a little bit on their terms, and speak to them in a language sort of that they understand. But that can be an issue for sure. And I think when it comes to that, the key is moderation and, again, having open relationships, open conversations with the caretakers or parents, as well as the patients, about, what they're doing, how much time they're spending on that kind of technology and, how to put some limits in place.
Of course. Tell us your approach about building trust and kind of a rapport with your pediatric patients. And their parents and guardians.
Okay. So trust is essential, anywhere from, like you said, the parents and guardians, all the way up to my adolescent males and females. So again, I think one of the most important things that I can do is be a good listener. I also try to show my patients and my parents that I can somehow relate, or I'm a mom also. Right. I have adolescent and young children, and that helps me to allow them to feel that I understand where they're coming from, and I'm not just there to see them and get through the visit. I really try to sit down and spend time with them, and we don't get to see quite as much of that in medicine nowadays, but I think that's really important, and then I feel that really helps them to see me as a helper and put their trust in me.
I feel like a lot of patients, they go into a doctor's office and they don't realize that doctors are regular people too.
Oh yeah.
And that they don't have, lives outside of their occupation. And growing up, my pediatrician, I said the same thing. I'm like, wow, this guy's a doctor. This is all that he does. But you don't realize that, later on down the line when I grew up, I understood that he had a whole life before
Right.
being a doctor. So,
Right. I run into many kids in Target or on my own children's sports teams that as soon as they see me, they just look at me and they're like, "Where's your white coat? Why aren't you in the
Right.
office?" Like they're totally shocked to see me on a soccer field or in a local store or something like that. It happens all the time.
It's too funny.
Yeah.
Tell me, how you stay updated with like the latest advancements, I guess, in medicine research and the best practices in pediatric medicine.
Well, that's important because medicine is changing all the time. We learn new things daily about the best way to take care of our patients. So I think there's lots of ways to do that. With technology, we have a lot of things at our fingertips, from research articles that we can get access to quite easily, to online learning. I try to attend conferences where they are updating new practices or best practices. I also will go back virtually to where I trained, and they do some online education for primarily their residents and their physicians, and you're able to dial in and kind of watch those and see what they're doing and see how practices are improving.
Right.
So.
And they have to be all different across the United States. I mean, every doctor has their own, medicine that they provide and their type of personality. So how does it give you an advantage with your patients of what you provide?
Well, I would say that medicine really is a beautiful mix of science and art. Of course, there is the science that we know, that we trust, and that's, we use to provide our care. But there's always a little bit of art or nuance to it.
Of course.
And that's where the personal touch comes in. Experience comes into play as well too, how you have dealt with this type of patient in the past, and what you've seen work or not work. And that can make a real difference in care, not just providing textbook medicine, really putting your own experience into it and what you've seen work and what works well for your community that you're serving, because that differs based on where you work.
Right. Now, if I'm an aspiring pediatrician, are there any current trends that I should be aware of in healthcare?
Well, as you mentioned before, there is a lot of technology, getting
Right.
involved with our healthcare system. So understanding that and understanding the good and the challenging parts of that, that's important. Being ready to use some technology, when you go into healthcare.
Of course.
That's also really important too, because that's changing, by the moment almost. And that's really good. I think it's also important to, medicine also changes in how it's practiced in different areas, is really to look into where you can work, where there's advanced types of, where there's different options that might work well for you in terms of how medicine is practiced.
Right.
So.
There's kids that come to you with difficult situations, I'm sure, in this profession, as many others do. How do you deal with those situations, their families, especially when, delivering a difficult diagnosis, or discussing treatment options?
Right. That can always be a little bit tricky, and sometimes emotional. And sometimes it can be hard to detach from that emotion. So in some ways I don't. I think it's important to act as a human being, not just their physician, with some level of understanding the emotional side of what they're going through. I also try really hard in challenging situations to remember that the patient that is there, they are the ones I'm there to advocate for, and they're the ones I'm there to treat. So, number one, they're my most important person that I am addressing and talking to and looking out for, but that the parents and family do play a big role in their lives.
Right.
And trying to really see it from their side of things can just help, sometimes even in the way I deliver it. it helps to try to put myself in their shoes a little bit so I can understand or anticipate what kind of questions they might have, what kind of worries they might have. And then again, it goes back to being a good listener and just sitting back and giving them time to process and ask any questions they might have.
Right. It kind of goes back to the, that you guys are individuals outside of the workplace, and that you guys endured tragedy and different types of scenarios as well.
Right.
So, what role do you feel that preventative care plays as being a pediatrician?
It's a huge part of what we do. Not only do we monitor our pediatric patients to make sure that they are developing appropriately and growing appropriately, but we have really a unique opportunity to kind of try to enforce some of that preventative and healthy lifestyles when they're young, when habits are being formed. It also allows us to kind of have some effect on the family, because we really encourage families to act and live in a healthy manner, not just their children. And therefore, it becomes a huge part of what we do, because right now is when kids are, forming how their lifestyles and forming, their thoughts on health and wellness, and we can really do a lot to help shape that. And anything that you do when you're a child affects you potentially down the road. So we really try to encourage healthy lifestyles and, preventative type medicine to benefit them as they become adults.
So for a kid, when their minds are consistently changing, I mean, as they grow, kids hit puberty, they have so many socio influences. Tell me how you kind of battle that. I mean, for a child who's constantly changing their mind.
Well, we do our best. So the way I look at it is that I know that children, adolescents, they are going to change, potentially between every visit, sometimes even within the same visit about what they're thinking.
Right.
And I try to remember that, and I try to be consistent in, my messaging to them, while also keeping in mind that they're going to have opinions and they're going to be working out. They're becoming adults, so they're really trying to work out who they're going to be and who they're going to develop into, and what they think and what they believe. So I try to, again, keep my message consistent and try to keep an open mind. And sometimes you just need a lot of close follow-up. So.
All right. Can you share any experiences where you've had to advocate for the needs of your patients within the healthcare system or community?
Well, one sort of general example that comes up a lot is with mental health care. A lot of time you don't think about that in the pediatric population, but that is something that does affect humans of all level, and that's something that we sometimes have a shortage of services and resources for our pediatric patients. So we've had to sometimes do a lot of advocating on their behalf, and really that becomes a team effort. It's really important as a pediatrician to, use the help of your nurses, if you have social workers or patient care coordinators, to really help find the best care, the best resources for your patient, whether that be a counselor, psychiatry, whatever that might be. And we do deal with that a lot in the pediatric population.
I'm sure, kids, like I kind of going back to the socio influence. I mean, these kids are dealing with so many problems at school. They're dealing with many problems at sports and all these things, and don't realize how much it really takes a toll on a child and their development.
Well, and they're changing so much all the time. It's, how they feel about the way something goes in the classroom, in the house, on the sports field, one day might be completely different from how they feel about it the next day. And that's a whole different thing to wrestle with on its own. But it's what keeps my job interesting. So
well, it keeps it fun too.
Yes.
So tell us how you address cultural and socioeconomic disparities in pediatric healthcare.
Sure. So that's really important to recognize, first of all, that different cultures have different beliefs and different outlooks on things. So I think the most important, again, is to listen. Listen to what families are saying are their needs or their wants. And also to be sensitive to the fact that not everybody lives the same life, whether it be because of culturally or socioeconomically. Not everybody has the same resources or wants the same types of interventions. So I think that trying to keep that in mind in balancing, what I would recommend versus what is realistically going to happen or actually even available to my patients is something that's very important, because it does no good for me to recommend a lifestyle or a treatment that they will not want to or will not have access to. So you have to keep an open mind about that and look at all options.
Becoming the best pediatrician, I'm sure you have to endure many of different scenarios. I mean, from all different types of socioeconomics and cultural backgrounds and whatnot. It's anything in life almost.
Absolutely. There are days when, I feel like every room, every door I walk through, it's like a whole different scenario, and that's really probably most days.
Right.
And again, the key is really keeping an open mind, being a good listener. Let them talk and let them tell you what's going on in their lives and what works for their lives is really important. Because I need follow through. If I give a recommendation, I need to make sure that I'm doing something that a patient and their family can follow through with.
Right.
And so again, taking the time to listen, spend a few extra minutes, with your patients and their families, to really have a full idea of what's going on in their lives is really important.
That personal interaction is everything.
Yes,
and
absolutely.
I feel like we're with the way technology is moving, we're kind of losing it a bit. And it's crucial for doctors to have a good relationship personally with a patient. And I hope that technology, the way things are going, we don't lose it.
Well, so I think that there's the positives and the negatives. So, of course, I don't like the fact that I maybe have to type on a computer while I'm trying to talk to a patient, where I'd rather just, look them in the eye more. And all physicians, I think we really work on doing that. But on the other hand, some of the technology that has come up with virtual visits and such can also have some real positive effects. It allows greater access to our patients, especially those that maybe because of socioeconomic reasons or other would have a harder time getting to us. So we can in a way come to them. It also sometimes gives us a little insight into how things go in their home. Is it chaos in the back? Can they barely find a spot that they can have quiet to speak to us? So in some ways it's a positive because it gives us a greater look of what's going on with them and interactions between different family members. So it's not all bad.
No, that's something I didn't even realize. The aspect is that being observant of what's going on in the background, you don't even think about it.
Right. When a patient and their family comes into our office, we might see the real them. We might see sort of the office, best behavior of them. Right. Sometimes seeing them in their home environment or in a more relaxed environment really allows us to get a better idea of what's going on with them. Sometimes, especially our adolescent patients, they feel a little more comfortable in talking to us when, they can sit on their own couch and do so.
Right. So if I'm an aspiring pediatrician, what are some ways that I can get some, in the field experience before medical school?
Well, there's lots of ways to do that. You can shadow physicians, try to find somebody that's willing to let you, come tag along and just watch what they do, watch how their day goes. Prior to coming to medical school, if you have time while you're in college for a part-time job or something like that. A lot of offices will hire, young adults or adults for medical scribes or to be patient care assistants. And then that's a really good way to see, how does this office really work? How does this, career really work? To see the realities, the day in and the day out of a true life of a pediatrician. I think that's a great way to not only get experience so that, you're better, a better applicant, say, for a medical school, but also to show you, is this really what I want? Is this really what I envisioned? Because sometimes it's not for any field. I've had plenty of friends go into medical school thinking they want it to go in one direction with their specialty, and then once they get a little taste of it, or get to experience a different one they never considered, they totally change their mind. So
Right.
any way that you can kind of get a little exposure to that is great. It's not all, I mean, while I love, interacting with the kids and playing with the kids, that's not all that there is to it.
That's
So,
true.
You have to be able to enjoy that and really do the medicine side of things also.
Yeah.
So,
lastly, for you, why pediatrics? Why pediatrics, and what advice would you give an aspiring pediatrician? What type of advice for them considering going in as a medical student and considering this as a career?
right. Well, I say, why not pediatrics?
Yeah.
No, honestly, there's a million reasons I love pediatrics. I love working with children, and I really love working with families. I love I love seeing my pediatric patients grow and mature, like we talked about. I really like helping to guide parents through that, because that's a lot of what I do, is talking to parents about what their kids are doing, how they're growing, and what to expect down the road. I really like advocating for my patients, so that part is a lot of fun too. I like a good mix of well patients as well as some illnesses, some chronic conditions as well too. So that's a big part of what I like about pediatrics. That's why I chose it. I kind of knew all along that's what I wanted to do. And what I would say, that if you're looking into medical school, or you're looking into going into pediatrics, just make sure you get a good exposure when you're in medical school. You'll have to try a little bit of everything to an extent, but really try to learn from all those other fields too, because you'd be amazed at how much we all interact with each other and how that all comes to play down the road. But get out there and try it out, and keep your eyes wide open, and really make sure that you consider everything about not only this field, but the other fields that you're looking at, from the types of patients we deal with, the types of work that we do, the type of clinical situations we work in.